I knew that if I wanted to be a doctor, I was pretty sure I wanted to be a surgeon because I've always enjoyed doing things with my hands. I think what sustains you is the personal connections with people. I don't think there's much of a more kind of personal connection you can get with a person than having operated on them with a good outcome. My name's Alex Bridges. I'm a cardiac surgeon here at Penn Medicine. We treat really the full spectrum of heart disease, and that includes mechanical circulatory support for heart failure, both short-term and long-term, valvular disease, valvular repair, valve replacement, revascularization, getting better blood flow to the heart to improve heart function. We do a lot of aortic surgery, both endovascular from within the body's blood vessels or open, more major reconstructions, which is the majority of aortic cases we do. The typical patient I meet is elderly, adult, and has had heart failure or a recent heart attack or valvular disease. Sometimes the rapidly progressing disease course, but sometimes with a long and smoldering disease course. It's really a mix. The other thing the cardiac surgeons do is, we're responsive to emergencies in terms of what we call eCPR, basically patients needing resuscitation who might be candidates for advanced mechanical therapies like ECMO, for example. My approach to care is pretty straightforward. I think that cardiac surgery should be explained in plain language, honestly, compassionately, so the patients can make dignified decisions according to their wishes. I don't think anybody really enjoys the idea of going to see the cardiac surgeons in the office. And so I think our job is to translate the fear of surgery into an honest and accurate understanding of the risks and the benefits. Because oftentimes there are tremendous benefits. I truly believe the best part of my job is connecting with patients. Most people are anxious, most people are worried, most people are scared. And to be able to guide them through the thought process that lets them feel comfortable with a decision to proceed with surgery and then do the operation and then watch as they have a good outcome going forward. Doing the surgery, actually enacting the care is great, it's fascinating, but a person comes in 3 months later feeling better than they have in years, and nothing beats that.